Well, the president just made a major announcement today, and it could mean another round of direct payments going straight to you. And no, this doesn't have anything to do with the $2,000 stimulus everybody's been talking about. This is something totally different, and depending on your situation, it could put real money in your pocket. So stay with me, because once you understand what's happening, it might completely change the way you look at your health coverage. Here is what's happening. Earlier today, the president posted a new message urging Congress to send money directly to Americans instead of sending billions of dollars to big insurance companies. To really get this, we have to go back to October and the first half of November. Remember the 43-day government shutdown? That entire shutdown happened because lawmakers were fighting over Affordable Care Act subsidies, what some people call Obamacare subsidies. Right now, the government spends billions paying those subsidies to insurance companies so that premiums are lower for people who buy insurance through the ACA marketplace. But the money never touches your hands. The government pays the insurance companies, and the insurance companies lower your monthly bill. In today's post, the president basically said, no more. Instead of giving that money to big insurance providers, send it directly to the people. In other words, you'd get the money yourself and decide how to use it, whether that's buying coverage, switching to another plan, or even keeping whatever is left over. Let me make something completely clear, because this is where people get confused. This has absolutely nothing to do with the $2,000 payment. That is a completely separate proposal. That payment is supposed to be a stimulus check, direct to most Americans. What we're talking about right now is an entirely different payment, aimed specifically at people who use the ACA marketplace for their health insurance. If you use Obamacare, this new idea would be an additional payment on top of anything else being discussed. These are two separate payments from two different programs. So who would actually get this money? This would apply to anyone buying their health insurance through healthcare.gov or their state's ACA exchange. Right now, about 21 million Americans fall into this category. That is a massive group of people. As for how much money you would receive, the president didn't give a number. It would depend on things like your income, your household size, and your current premiums. For some people, it might be a few $100s. For others, it could easily be a few thousand. All we know is that billions of dollars currently going to insurance companies could instead be redirected straight to you. Now, let's talk about the real question. Is this actually going to happen? First, it would have to be approved by Congress. And remember, ACA subsidies were the reason the government was shut down for 43 days. Lawmakers were nowhere near granting an agreement on this. Healthcare policy is one of the most divisive issues in Washington. There are huge practical questions, too. If millions of people suddenly get cash instead of subsidized premiums, what happens next? Would people lose their current plans? Would they have to shop for new insurance? Would premiums skyrocket because insurance companies aren't getting government payments anymore? There are serious concerns here, especially for people with ongoing medical needs or expensive prescriptions. Thirdly, even if it were to pass today, which is exceedingly unlikely, the systems to support paying millions of people would take months to build. It's something that simply can't be done quickly. Here's the big picture. If you've been following along this year, you'll notice that the president has consistently advocated for the various forms of direct payments. The $2,000 checks, the tariff-based dividends, the rebates, and now this idea of redirecting the ACA subsidies. There is a clear pattern here. The goal is to put money directly into the hands of the public instead of filtering it through corporations or complicated programs. Whether that's a good idea or a bad idea depends on your political views. But the strategy is obvious. The issue is that all of these proposals cost serious money, and Congress is worried about the national deficit. Some maintain that redirecting money that's already being spent doesn't increase the deficit at all. Others say it would disrupt the entire health insurance system. This is a debate with strong opinions on both sides. So what should you do right now? If you get your insurance through the ACA, keep your coverage exactly as it is. Don't cancel anything. Don't skip a payment. Nothing has changed yet. If you're on Medicare, this particular proposal doesn't impact you, but your enrollment deadline is coming up, so make sure you're covered. Stay informed, but be skeptical. Plenty of proposals floating around, and most of them may never become reality. And if you're struggling with healthcare costs today, look into programs that already exist. Many states, nonprofits, and clinics offer assistance right now, not someday in the future. Let me break it down again. There are potentially two different payments in play here. First, there would be this $2,000 stimulus payment that would go to the majority of Americans. That has not yet passed, but it's been talked about for weeks. Second comes this notion of diverting these ACA subsidies directly to the people rather than to insurance companies. Only people on ACA marketplace plans would get such payments. If both ended up getting approved, someone with ACA coverage might get both payments. They aren't tied together, nor is either one a sure thing. Both require approval from Congress, and neither will be a slam dunk. Look, I know health insurance is complex and overwhelming. It's easy to get excited by the prospect of possible payments or frustrated when things seem unclear. But my feeling is this: the fact that direct payments are being brought up time and again is meaningful. That continues to put pressure on lawmakers, and it keeps these issues in the national conversation. At the same time, many proposals sound promising and never become law. So, I am cautiously optimistic, but still very realistic. What I can promise you is this: the moment there's any real movement, whether it's a vote, a bill signing, or an official payment timeline, you'll be the first to know. Be sure to subscribe below and hit the notification bell so you don't miss those updates. If you're needing help today with food, rent, utilities, or medical bills, check out the resources linked on the channel. And let me know down in the comments, would you rather get the ACA money as cash or have it directly applied to your premiums? I'm actually curious. Thanks for watching. Take care of yourself. Plenty of proposals floating around, and most of them may never become reality. And if you're struggling with healthcare costs today, look into programs that already exist. Many states, nonprofits, and clinics offer assistance right now, not someday in the future. Let me break it down again. There are potentially two different payments in play here. First, there would be this $2,000 stimulus payment that would go to the majority of Americans. That has not yet passed, but it's been talked about for weeks. Second comes this notion of diverting these ACA subsidies directly to the people rather than to insurance companies. Only people on ACA marketplace plans would get such payments. If both ended up getting approved, someone with ACA coverage might get both payments. They aren't tied together, nor is either one a sure thing. Both require approval from Congress, and neither will be a slam dunk. Look, I know health insurance is complex and overwhelming. It's easy to get